Self-Esteem, Optimism and Burden of Care Among Relatives of Cardiovascular Disease Patients in Selected Tertiary Hospitals in Southwest Nigeria. This article is written by 3 authors. First author Stephen Ishila Babatund. Second author Tafik Olatunji Bankole. Last author Rashidit Bayo Yanusa. Contribution and originality of the study is that the paper's primary contribution is that it documents empirical findings that are useful for research, clinical practice and counseling. As such document provides insights on the experience of these informal caregivers or strategies for valuable intervention programs to reduce the burden among relatives of cardiovascular disease patients. Providing informal care, particularly for a person needing assistance for daily activities as a result of chronic illness such as cardiovascular disease, CVD, is a demanding task which requires time, dedication and preservation. In spite of burdens that caregivers of CDV patients are faced with, there are dearth of studies that have explored the level of the burden of care among relatives of CVD in Nigeria. This study addresses this gap by raising the question, to what extent does care for CVD patients affect caregivers' psychological, behavioral and physiological daily lives? The study was a cross-sectional survey and it adopted the purposive sampling technique. Primary data were sourced from 200 caregivers, relatives from 3 tertiary hospital, Federal Teaching Hospital Edo Ekiti, Federal Medical Center Owo and Obafemi Awolowo Teaching Hospital Complex Ile-Ife. The outcome variable is caregivers' burden, and the key explanatory variables are self-esteem and optimism. The Zarit, ZPIS, Rosenberg Self-Esteem and Revised Life Orientation Test, LOT-R, standardized psychological scales were employed to measure caregivers' burden, self-esteem and optimism. Pearson R was applied using STATA version 13. Results shows that a significant proportion of the caregivers experienced moderate to severe levels of burden. Also, results shows that caregivers' burden was not significantly associated with self-esteem, R200 equals 0.04, p.025, and optimism, R200 equals 0.07, p.025. It was imperative to provide professional help and supportive counseling to caregivers of CVD patients, in order to reduce their burden, strengthen the coping skill and thus improve their quality of life. Thanks for watching this video of Journal of Diseases Volume 6 Issue Number 2.